Heart disease. It affects so many. I'm sure you know someone personally that suffers from heart disease, maybe someone in your own family. Those affected with heart disease are destined for a life of drugs, other diseases such as diabetes, surgery, and even death. Does it have to be this way? Is there an answer? Let's join Dr. Craig Rolls and see if he can shed a glimmer of hope to those affected with this disease. Dr. Rolls?
Heart disease did not even exist 100 years ago, and now it's become the #1 killer in America, with an American dying every 30 seconds from this terrible disease. Heart disease is a disease of nutritional ignorance. It's just simply by not having the knowledge, and I hope to show you today there's an answer for heart disease, and the answer is not in medications, it's in food. The American diet today is a sure way of getting, it's designed for heart disease and diabetes. The American diet consists of 62% refined carbohydrates, refined foods, that's your pastas and your nachos and your pizzas, and then 22% animal products, and all these products are very, very, very low in nutrients. Half of our carbohydrate count come from half of our vegetables come from potatoes and French fries, and only 5% from actual real vegetables. And so when you start to look at the American diet, and you see how few nutrients we get into our body and how it increases the weight of our country. We have a raging increase in obesity in our country. There's no wonder that we still have, even though we spend the most on healthcare in the world, we are the 15th country when it comes to healthcare and the prevention of heart disease and diabetes in the world. So we have a broken system, and it's terrible. We have a tendency to lean upon the medications, for instance, for heart disease, and then it gives us like an excuse to just kind of live our normal and everyday life, but it does not work, and that's why we're dying from this terrible disease. Stress tests, which are used to diagnose part of this disease, also focus on old plaque, which we see are calcified inside the body, and yet most of these conditions of heart attacks come from young plaque that's just newly formed and we don't see and goes into the heart and can cause a heart attack. And so I really want to show you today are real things you can do to change your lifestyle, and in changing your lifestyle, change your risk for heart disease, and in case you have a high cholesterol or you have high blood pressure, maybe reverse those conditions as well. And that consists of a whole food plant-based lifestyle, consisting of vegetables, mostly green vegetables, beans, high level of beans, fruit, whole fruit, brown rice, and nuts and seeds. And a diet like this, you don't have to be vegetarian, but if you are 90% of your life living like this, it has a huge impact in supplying the nutrients your body needs, increasing your energy, decreasing the amount of fat in your body, and improving your health. As we gain weight as a country, what happens is it also has a huge impact upon our risk for diabetes. And diabetes is one of the leading factors that increases our heart disease risk, with over 400% increase in risk of a heart attack if you have diabetes. A third of the diabetics will die of a heart attack by the age of 50. So what happens with our body as we gain weight, our ability to use insulin reduces. Insulin is important because insulin helps to monitor our blood sugar, gets the blood sugar into the cell, reduces the overall sugar level in the blood. As we gain weight, our insulin increases. In fact, if we gain weight by 20 pounds, we have a double-fold increase of insulin in our body. If we increase 50 pounds, we have a 10 times fold increase of insulin in our body. So it creates a situation where our pancreas, which is the organ that's producing this insulin, has to work harder and harder and harder until it just can't do it anymore. And when it shuts down and our blood sugars rise, that's diabetes. And of course, that's what's going to cause us to be at such high risk for heart disease. And so the way to change that is by using your vegetables and your beans and your nuts and your seeds and your whole foods. Vegetables are very effective inside the arteries. They actually make the arteries inside become more smooth, and the endothelium is called, technical words is for inside the artery, makes them more smooth. Because the key for heart disease is making sure you don't have a plaque buildup. And the vegetables also reduce that plaque. In fact, there's a chemical in the body called NRF2. It's not important to know technically what that is, but the micronutrients help to get that chemical to work on the high pressure situations inside the blood vessels, whereas very commonly they will have an increase in inflammation and plaquing form. So the vegetables are amazing at their ability to clear out the nutrients, make them clear out the arteries, and make them smooth and make them work properly. Beans are a miracle food, and what they do is they help with your weight loss, because beans, only 40% of the calories are absorbed when you intake beans, when you eat beans. And as a result, the blood sugars are stabilized a longer period of time. And they break down into what we call short-chain fatty acids. And all that means is that the beans turn into healthy fats for you, and they help to remove the bad fats. Nuts and seeds are also a very powerful part of this program in eating well for a healthy lifestyle. Nuts and seeds have an impact upon especially LDL cholesterol. You know, a lot of people have high levels of LDL, and they've been told they have a high risk for heart disease, and that's true. Well, nuts and seeds have a great impact upon reducing those levels of LDL, actually suck that out of the body and get the body into a much, much healthier place. In the area of fruits, it's very, very important to eat whole fruit. Don't eat fruit juices, because the fruit juices increase our blood sugar levels too rapidly. Again, can cause increase in weight gain and also create a situation where we are more prone to having a diabetic reaction that also leads to heart disease. You know, it's very important to take a look at these different ways to live. There's a book you can read called Eat to Live by Dr. Joel Fuhrman. And it's a great book because it also will detail out for you a program you can put yourself on and also work with. Talk to your chiropractor about this, because he'll be able to assist you in learning how to change your life in a way where you can reverse your diet, reverse your heart disease if you have that, or high cholesterol, and also be able to put you in a high state of prevention. Now, also, I'm sure there are friends and loved ones in your life that may be suffering from high cholesterol or high blood pressure, or have some of the complications from these terrible diseases. Well, tell them about these methods they can do. Share with them what your chiropractor has to say, and get them into your office, because by doing this, you can create a situation where you can extend the gift of life and health to another individual, especially a loved one, which is not what is better than that. So it's important to know that this is a disease, the heart disease, that can be reversed. It does not need to be our #1 killer. It does not need to be ravaging us and creating widows and orphans out of those that are our loved ones that are so close to us. The problem with most of these diseases too is when they do attack us and we have us suffering a bad incident from this, such as a stroke. You know, it'd be one thing if you just died as a result of the incident, but most people don't. They like halfway die. You know, if they are in a stroke, oftentimes they just can't function. What a terrible burden to put on that individual and their family as well. So to prevent that from ever happening in your life, and also in the life of your loved ones, take a look at your lifestyle and what you can do, and talk to your chiropractor about learning how to live in a whole food, plant-based lifestyle. And read the book, Eat to Live. It'll change your life along with your doctor. And I wish you the best in making this change for you to make it a healthy outcome for you and your life and your family.